operation. Now to a new vision correction procedure. It's called Epi-LASIK, and it was recently approved by the Food and Drug Administration. The procedure now makes laser surgery an option for some people who had to rule it out in the past.
All my life, I cannot remember not wearing glasses. As a child, I grew up with glasses.
Julia Gross dreamed of the day when she might be able to get rid of her glasses for good. Working for a group of eye doctors, Julia often heard the patients rave about their results from LASIK surgery. But doctors told her that wasn't an option for her because of her thin corneas.
One of our doctors had surgery with Dr. Rubinfeld, and when we were there, I had talked to him saying, well, you know, when is my chance here?
Julia's chance came just a few weeks ago when she underwent a new procedure called Epi-LASIK.
Epi-LASIK is one more tool to correct people's vision.
Ophthalmologist Dr. Roy Rubinfeld recently started performing Epi-LASIK on patients who weren't good candidates for laser vision correction surgery until now.
People who have thin corneas, or their mapping of their corneas are a little abnormal, might be very good candidates for Epi-LASIK.
Unlike LASIK, in which a flap is cut into the tissue of the cornea, Epi-LASIK works on the surface of the eye. The cells that make up the very top layer of the cornea are separated and pushed to the side. Dr. Rubinfeld applies a laser to correct the patient's vision and then moves the top layer of cells back into place. There's no cut. A temporary contact lens is put on the eye to act as a Band-Aid.
Okay, one down. So did great.
The Epi-LASIK procedure takes a little bit longer than traditional LASIK, about 15 minutes to do both eyes, and it can take a little longer for the vision correction to fully develop.
LASIK, most people the next day, they're really seeing pretty well. They're driving, they're back at work, over 90%. Epi-LASIK, about 3 days to 4 days is more common.
At first I had like a little halo effect going on, or it was like a fog.
But Julia Gross gradually noticed an improvement in her vision.
About a week later, I came to the point where I said, okay, now this is, oh look, I can see this, and now I can see that.
She's thrilled with the results, but admits she's still reaching for her glasses simply out of habit.
New life, it's great. Don't miss them at all.
The cost for Epi-LASIK is about $5,000 for both eyes. That's about the same cost as LASIK. Dr. Rubinfeld says Epi-LASIK is not necessarily better than LASIK, but it is one more option to help customize vision correction procedures and make them available to more people. For more information, you can visit our homepage, NBC4.com, and look under News for Your Health. Susan, Wendy?